Okay, good afternoon everybody. We've just been called to Mr. Teddy Bear here at the local skate park. Mr. Teddy Bear has come off his BMX bike and has come a crop. He's complaining of left-sided chest pain. We're going to assess the scene for any danger to us. We're also going to be wearing our PPE and masks, goggles, gloves, and what have you. And like I said, assess the scene for any danger to us. We're doing a rapid trauma survey, and getting to B for breathing, we've noticed that he has difficulty breathing. There's unequal breath sounds on both sides. He has some raised JVD, jugular vein distension. Also that we've got some tracheal deviation heading to the right, and also decreased, when we auscultate we notice decreased breath sounds left hand side. When we percuss we notice some hyperresonance. So we actually think that we might have a tension pneumothorax here, a pneumothorax that's tensioning. His breathing is getting worse. We noticed that there is also some cardiovascular compromise there as well. So I'm going to explain to Mr. Teddy Bear what we think's happening and how we're going to solve that problem. So I'll explain to him that what a tension pneumothorax is, and how we're going to help him. So do we have your permission, Mr. Bear? Yes, he's happy for me to go ahead with that. So the first thing I'm going to do is mark out my site. So I'm going to find the mid-clavicular line and then move down two spaces to the second intercostal space. I'm going to mark that up. Then I'm going to use my Alco wipes to clean the site. So I clean the site. There's enough of that marking left there that I'm happy that I can still identify the site. I've marked up the site. Now I'm going to use a needle or a scalpel. I'm just going to nip the skin over the site because it can be quite difficult to put the 12 gauge cannula. I'm using a 12 gauge cannula to go into that site. So I'm going to cover at a 90-degree angle, riding over the top of the third rib, and that'll mean that or help to ensure that I don't hit the neurovascular bundle sitting under the rib. So if I sit over the top of the rib, I should be able to miss that. So I'm placing the catheter in at a 90-degree angle over the third rib until I feel a pop as it goes into the pleural space, or a large hiss, or I see blood coming out. A hiss of gas and blood coming out as I've got into that pleural space. I've got in there now. I'm going to remove the catheter, and I'm going to pop that in a sharps container. I'm going to secure the catheter that's still in situ with some tape, and I'm also going to add a one-way needle valve. I apply the one-way needle valve. Then we're going to reassess the patient, make sure that there's not a second pneumothorax starting. We're also going to assess his right side to make sure that there's not one developing on that side. We're going to apply oxygen, or we would have applied oxygen we would have given him lots of oxygen before we started, or during the process. We're going to give him oxygen just to assist with any breathing issues that he has and keep his oxygen levels nice and safe. And that is Mr. Bear, basically.